Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Enalapril, or Vasotec. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. In this presentation, we'll talk about the mechanism of action, or how this medication works, indications or reasons we would prescribe Enalapril to patients, followed by contraindications or reasons we would not be able to prescribe this medication. We'll then discuss examples of dosing, and then follow it up with side effects. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So enalapril maleate inhibits angiotensin converting enzyme, or ACE. It is believed to lower blood pressure by suppression of the renin-angiotensin-aldosterone system. Inhibition of ACE blocks the conversion of angiotensin 1 to angiotensin 2. This causes a decreased vasopressor activity and decreased aldosterone secretion. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in hypertension or high blood pressure, as well as in heart failure. If a patient had asymptomatic left ventricular cardiac dysfunction with an ejection fraction of or less than 35%, they would also potentially be prescribed this medication. In terms of contraindications or reasons we would not be able to prescribe enalapril, medication is not to be used with aliskiren in diabetic patients. If a patient had hereditary or idiopathic angioedema, they would not use enalapril, as well as if they had a hypersensitivity to enalapril or any other component of the formulation. It's not to be used with nephrisiline inhibitors, such as sacubitril, and also if a patient had a history of angioedema related to prior therapy with an ACE inhibitor, they would not be given this medication. Now for some examples of dosing. So in hypertension or high blood pressure, we may see an initial dose of 5 milligrams orally once daily with a maximum dose of 40 milligrams per day. This medication may be administered twice daily, and the usual dosage range would be 10 to 40 milligrams daily in single or, like I mentioned, divided doses. Initiate at 2.5 milligrams per day if used with a low dose diuretic. In heart failure, it looks like we'll start off here with an initial dose of 2.5 milligrams orally twice daily and a maximum dose of 20 milligrams taken twice daily. This medication should be titrated to target dose over a few days or weeks. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using enalapril, so we'll go over some of those here now. Hyperkalemia, or high potassium levels, may happen 1 to 4% of the time, while dizziness may happen 4 to 8% of the time. 3% of patients using this medication may experience fatigue. Some patients may experience a serum blood urea nitrogen rise. As well, their serum creatinine may be raised. And hypotension, which would be more of a serious side effect, can happen 1 to 7% of the time. Alright everybody, that's all we're going to talk about today with enalapril or Vasotec. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.